Hello, I'm Dr. Marla Shapiro, and I sit on the Board of Trustees of the International Menopause Society. And today I'm joined by Dr. Céline Bouchard. Dr. Bouchard, first tell our audience of women who you are and what you do.
I am a gynecologist from a French-speaking part of Canada. I am from Quebec City. I am specialized in a vulvar condition for women. So I am a fellow of the International Society of Vulvar Diseases. I am also interested in menopause. I am vice president of Canadian Menopause Society here in Canada.
So let's first start with that word vulva, because for a lot of women, they aren't really sure what that word means and what part of the anatomy are we talking about when we use the word vulva. So as a woman, what does that mean?
Yes, for sure that they have a lot of surname a lot of little name for the vulva. But you know, you have to think about that it's a very important organ for women. Without a vulva, we don't have any delivery, we don't have any intercourse, we don't have, you are not able to go to the urine. So it's a very important organ. And then what is it? Is it the labia majora, labia minora, the perineum, the region between the entrance of the vagina and the anus? That's the big area with hairy part and some not hairy part.
Right. So it's that entire exterior part that women don't recognize as that name.
The clitoris. I forgot to mention the clitoris, a very important organ for women.
So what are some of the more common symptoms if a woman has a disease or a concern related to the vulva? What will they be experiencing?
They will experience pruritus, burning, and dryness with intimacy. So pruritus is very frequent for postmenopausal women. It's mostly secondary to GSM, genitourinary symptom of menopause.
So here we're talking about itching as opposed to dryness.
Yeah. Itching, sorry to use pruritus, itching is more common. So yes, I'm talking about itching. So it's very common for women. It's mostly secondary to GSM, and it's going out with local cream or local estrogen just to put some estrogen on.
Okay, so for women who are having itching or dryness, how do they differentiate between whether or not this is part of estrogen deficiency, they're in menopause, they don't have estrogen and they get dryness, or whether or not there's actually a disease process that's going on in the area of the vulva? What is it they should be looking for?
But they are looking for some lesion of the vulva, and it's very difficult for women to look at the mirror to see the vulva. It's very difficult. So I will recommend to see a healthcare provider to do the examination of the vulva to be sure that they have no disease, because they can have a lesion and they can see that. So I don't agree to have a auto diagnosis because it's not clear, and they can have also infection, candidiasis. They can have a lesion. So I don't agree with auto examination and auto diagnosis.
But it does, again, highlight the point that even if you're past the age of doing a regular pap test, you should still be having your vulva looked at in an examination.
For sure, but because you have disease, a specific disease like lichen sclerosis, lichen planus, dermatosis. You get can cause burning, pruritus, deformation of the vulva, loss of architecture of the vulva, with stricture of the vagina, with difficulty with intimacy. So it's very important that patient as an exam.
So for these conditions that you've mentioned, which are for the physician to diagnose, lichen planus or lichen sclerosis, can any of these become more advanced and lead to more worrisome outcomes? Can we see cancer in this area?
Lichen sclerosis mostly can transform because of the scratching of the people. It's very itchy, so the people scratch themselves, and with they can transform to precancerous and cancerous lesion. 2 to 4% will develop a cancer with this condition. If you treat the patient with a corticosteroid, the rate of cancer decrease. with
Mhm.
times.
And so treatment is critical.
It's
And
critical.
can you just talk about a little bit in terms of the fact that often women are unaware about the type of hygiene that the vulva involves and how we actually protect and take care of this very important organ?
Yeah, I will say that maybe to clean the vulva too often is not good. Huh? You have to don't wash yourself more than once a day. You don't have to take scented soap. Don't
Right.
take any deodorant to the vulva. Don't take any cosmetic product in the vulva. That's bad habits. You have to don't use douches because vaginal douches because we will change your flora or your microbiota that is very
Mhm.
important in the vagina. So and you will increase the rate of infection post douches, vaginal douches. So
So
that's
as
the main point. Don't use any scented soap.
right, right. So
The body
aside
scent.
from lesions that a woman may not see, what are the symptoms that should drive her in to see a healthcare practitioner? If you experience this, then you should have someone look. What are the types of symptoms that women should not ignore?
Pruritus, burning of the vulva, bleeding from a lesion on the vulva, dryness and difficulty with the intimacy, with the fissure and the bleeding when they have intercourse. So that's the main point that require an exam from a healthcare practitioner.
So I think, the message that we're giving to women in general is one, the importance of this organ, the importance of proper hygiene. And secondly, that if you do develop symptoms, examining yourself can be most difficult. And it really is important to seek that appointment. So many women would rather sort of just put it away and think, oh, it's part of aging. But this is not part of aging.
No. And then the women, thank you to talk about that because the women are very shy to show themselves, particularly to a man, and they are reluctant to do that. But
Yes.
be aware of that your care provider are not judgmental and they will not create about your vulva, a lot of bad comments. So don't be shy and go to see the practitioner.
Well, thank you so much for highlighting this area of healthcare that we often don't talk about. Many women don't even know what that definition of vulva is and the importance of vulvar health. And thank you for walking us through this area. Thank you for joining us today.
Thank you very much, Marla, to invite me.